Hello everyone, and a very warm welcome to our channel. Me, I'm Dr. Inayat Ullah, MD, a board-certified psychiatrist, certified sex therapist, sexologist, mental health specialist, and relationship and couple therapy specialist based in New York, USA. It is an absolute pleasure to have you join us today. Whether you're watching from the USA, Pakistan, India, the Arab world, or Europe, we're thrilled to have you as part of our growing global community. Before we begin, I would like to remind you to subscribe to the channel, give this video a like, and share it with your friends, family, or colleagues who may benefit from this discussion. Supporting this channel allows us to continue producing high-quality educational content that addresses mental health, sexual health, relationships, and public health concerns. I also want to let you know that you can reach out to me or my team through our website emarkimi.life or our Facebook page. We provide online consultations, therapy sessions, workshops, and internship opportunities. And if you're looking to become a part of our team, we are actively recruiting passionate individuals from around the globe to join us in providing care, education, and research. Today's log is going to be a long, detailed, and important discussion about a virus that is often overlooked but extremely dangerous, the Nipah virus. We will cover its clinical features, transmission, neurological and psychological implications, prevention strategies, and global significance. So sit back, grab a notebook if you like, and let's dive into this comprehensive discussion. The modern world repeatedly encounters emerging infectious diseases. While some outbreaks immediately make global headlines, others, like the Nipah virus, often remain under-recognized despite being highly lethal. Nipah virus, also known as an IV, is a zoonotic virus, which means it can be transmitted from animals to humans. Its danger is twofold. It has a high fatality rate and significant neurological and psychological consequences. In my professional clinical experience, patients affected by NIV often experience not just physical illness, but also profound mental health challenges. The virus has the ability to directly affect the brain and central nervous system, which is why it is a matter of concern for both medical and mental health professionals. Today, we will explore everything from the history and discovery of the virus to its clinical manifestations, neuropsychiatric effects, diagnosis, treatment options, and prevention strategies. We will also discuss its psychological impact on patients and communities and why global collaboration is essential. Now, take a moment and think about the last time you heard about an emerging virus. How did it make you feel? Fear, curiosity, awareness? Keeping these reflections in mind is important because our emotional responses play a role in public health behavior. The Nipah virus was first identified during an outbreak in Malaysia between 1998 and 1999. Most affected individuals were pig farmers who initially presented with fever, altered consciousness, and neurological symptoms. Interestingly, these initial cases were misdiagnosed as Japanese encephalitis. Only later, through detailed epidemiological and virological investigations, was it discovered that the actual cause was a new virus transmitted from fruit bats to pigs and then to humans. The virus was named Nipah Virus after Songhai Nipah, the village where the outbreak was first recognized. Subsequent outbreaks in Bangladesh and India highlighted a concerning fact: human-to-human transmission. Family members, caregivers, and healthcare workers were at risk. This makes Nipah virus not only a veterinary or wildlife concern, but also a serious public health issue. And in my clinical practice, I have seen that even the fear of infection can lead to significant mental health concerns, including anxiety, depression, and post-traumatic stress in affected communities. The primary natural host of Nipah virus is fruit bats, which carry the virus asymptomatically. They spread the virus through urine, saliva, blood, and feces, contaminating food sources and surfaces. Transmission pathways include animal to human, contact with infected pigs or other animals, foodborne, consumption of raw date palm sap, or fruits contaminated by bats. Human to human, close contact with bodily fluids, respiratory droplets, and caregiving. It These modes of transmission make the virus particularly concerning. Even seemingly safe environments can pose a risk if proper hygiene and precautions are not maintained. I want to hear from you. Have you ever come across raw date, palm sap, or fruits that might have been contaminated by bats? Comment below your experience. I read all responses, and it's helpful to understand public awareness. The incubation period of Nipah virus usually ranges from 4 to 14 days, though rare cases report up to 45 days. Early symptoms are often nonspecific: fever, headache, fatigue, muscle pain, nausea, and vomiting. As the disease progresses, patients may develop shortness of breath, persistent cough, dizziness, sore throat, altered mental status. Severe cases can lead to acute encephalitis, seizures, loss of consciousness, coma, acute respiratory failure. Neuropsychiatric manifestations include acute delirium, anxiety and agitation, hallucinations, personality changes. It is essential to remember that survivors often experience long-term complications such as cognitive impairment, speech difficulties, seizures, chronic fatigue, and psychiatric conditions like PTSD and social withdrawal. These challenges emphasize the need for multidisciplinary care. Diagnosing Nipah virus is complex and requires specialized laboratory tests such as RT-PCR testing of blood, cerebrospinal fluid, urine, or throat swabs. EL is for antibody detection. Early diagnosis is critical to contain outbreaks and manage patients effectively. Currently, there is no specific antiviral treatment or approved vaccine. Clinical management is largely supportive, including intensive care, monitoring, oxygen therapy, or mechanical ventilation, management of seizures and cerebral edema, strict isolation, precautions. Experimental treatments such as ribavirin or monoclonal antibodies are being researched but are not widely available. Healthcare professionals watching this is an area where your involvement can make a difference. We conduct workshops and training for professionals in infectious disease, psychiatry, and public health. Since there is no definitive treatment, prevention is the most effective strategy. Public health measures include avoiding raw date palm sap peeling and washing fruits, thoroughly preventing bats from accessing food sources. Healthcare precautions include using personal protective equipment, PP, following strict infection prevention protocols, isolating suspected cases from a psychological perspective. Outbreaks can cause fear and panic, stigmatization, rumors, and misinformation. Integrating mental health care into outbreak response is critical for societal well-being. Nipah virus is recognized by the World Health Organization as a priority pathogen due to its high mortality rate potential to cause a pandemic. Lack of treatment options to fight this virus. We need early detection and monitoring, public education, reliable healthcare systems, mental health integration, global collaboration. At IMACMI, we are committed to providing education, care, and research opportunities worldwide. We are expanding our services across Pakistan, India, the Arab world, Europe, and the USA, and we are actively recruiting team members to join our mission. Thank you so much for joining this in-depth discussion on Nipah virus. Don't forget to subscribe, like, and share this video. If you want to connect with me or my team for online consultations, workshops, or internships, visit imarkimi.life or our Facebook page. Stay informed, stay safe, and take care of both your mental and physical health. I'm Dr. Inayat Ullah, and I look forward to seeing you in our next video.